The views and opinions expressed in the following program are those of the participants and do not necessarily reflect those of KSMQ Public Service Media Incorporated or its assigns.
Nurses are a critical part of healthcare. Even though nurses endure strenuous labor and are continuously asked to take on more responsibilities, they provide personal nurture and assistance to nearly every American during their lifetime. Today, we are joined by nurses from varying specialties. I'm Sean Riley, and you're watching Health Connections. Today, we're discussing the field of nursing. Joining me from Austin and Adams, Minnesota, are our guests, Ms. Tammy Snee, Nurse Manager at the Austin Medical Center, Mayo Health System, and Shannon Dreyer, RN at the Adams Nursing Home. Tammy and Shannon, welcome to our show.
Thank you.
So, could you tell me, what do you do as a nurse? And Tammy, we'll start as you, and how long have you been in the nursing field?
I have been a nurse for 15 years. I worked mostly in the hospital setting, and 3 years ago came to Austin Medical Center, and I'm currently the manager for home care and hospice.
Okay, great. Shannon?
I recently graduated last May,
Okay.
and I've been working at the Adams Nursing Home since July.
Okay, so just under a year that you've been
Yep.
in the nursing field.
Yep.
Great. So Tammy, I'll throw this one at you. How has the field changed for you in your years? How has this evolved for you over the last 15 years?
Well, the people that I work with have careers that are probably 10 to 15 years longer than mine. So with that perspective, my time has been short, but I think technology has had a huge impact on how we are documenting and just keeping track of our patient. And just the sharing of communication and the ability to research and the patient being well educated has really changed how we approach our patient care.
So Shannon, have you heard the same thing? Where does everyone talk about the days long ago and what used to be, and or
Some, and we do have a lot of new nurses there too.
okay,
So, and we see a lot, there's more changes. We come up with, different ideas, and all the nurses that work there, everybody seems to kind of work together and welcome the new changes if anybody has any new ideas.
So being so new to the field, is it what you expected? Do you expect to see huge technological advances everywhere, or how has it been for you?
Well, working at the nursing home is quite a bit different than working at the hospital.
Okay.
When I did my training, technology was much different there. We had the electronic charting. Everything was on the computer. Mm-hmm. And now at the nursing home, it's different because we still are using paper charting. Mm-hmm. So it's a little different than I anticipated, but...
No, that's one of those interesting contrasts, really, is that about 94% of the country's medical care is still done on paper. I mean, there's very little in reality that's still moving, has gone to electronic already. Everyone is going that direction, but we haven't gotten there. Mm-hmm. So was that something that you thought you would see? I mean, did you expect to walk into the nursing home and see all electronic systems?
I knew they weren't going to have it.
Okay.
We do communicate, with Austin Medical Center, and they'll send faxes down with, new orders, blood tests, results. So we do have Austin Medical Center to kind of keep us in the link, but as far as us nursing and our charting, we still are paper. So I knew it was going to be paper. So.
Do you think that's going to change soon?
I don't think anytime soon.
No?
Hopefully.
Okay.
I think one thing about the field Shannon's working in, the nursing home is so heavily regulated that a lot of their time is spent focused on being in compliance with those regulations and staying up to date with that.
Yeah.
It's a really big deal to transition to a computer environment with all of that in mind.
Do you think it comes down to cost in that sense? That
I'm sure it does.
All of the money's
Everything
just dedicated
does.
towards, everything's just dedicated towards regulation and not towards advancement.
Well, first the patient and then staying in compliance.
Okay, okay. So Tammy, for you, being in an electronic world, used to be paper for you, now moving to electronic, how has that changed what you do?
I think the biggest misconception all of us had was that it would save time, and it hasn't saved time. I think we're able to access information in a more thorough manner quicker, but getting it in the system has taken us time to learn and to get used to. I think overall it's been beneficial, and hopefully, the sharing of all the electronic health record will only enhance that and make it a safer environment for our patients.
I know nationally, as this debate continues with EMRs, indefinitely, it is always, everyone mentions saving money. And I think we've had this discussion on this show before, actually, about how it's not necessarily a cost saver and not necessarily a time saver. But what do you see as the huge benefits in quality and safety aspects? And
I think that probably is the biggest benefit, and it has to be the priority. And in the long term, the investment will be well worth it, because our patients will ultimately come out, and we're all patients eventually, so it benefits everyone, even ourselves.
So, Shannon, in the nursing home, what do you think, if you were able to bring in technologies of some sort to be able to help the patients, what do you think would be the most beneficial? What would really be your bang for your buck there?
I think kind of like what Tammy said, with being able to access, the old charts or the charting that was already in there, we'd be able to see it instead of flipping through, 5-10 pages to see when maybe one of the last appointments were or something like that. I think it would make it a little more organized, so it'd be quicker to get the information.
Okay. Well, let's shift gears a little bit and go, the general public has all sorts of varying ideas about nursing. We see all sorts of stuff on television about what nurses are and what nurses aren't, and people really have these huge varying ideas. Tell me about your days as a nurse. I mean, is it lots of lifting? Is it if you watch Grey's Anatomy, basically you're standing there waiting for a doctor to tell you something, and yet my experience, nurses tend to be incredibly active. Tell me about your day a little bit. Maybe Shannon, we'll start with you.
Ours is pretty hectic, really. It's we have anywhere from 45 to 48 residents. There's usually about 3 nurses, or we have trained medical aides too that work occasionally, or LPNs, and it seems like you're constantly doing something. We try to be really organized, and everything's got its time to do it, but I'm sure Tammy can relate to this. You're a nurse, and if you're right on time, then you're not doing your job. So, I mean, you constantly, something comes up, and you have to help somebody, and so you drop, you prioritize, you drop what doesn't need to be done now. Charting can always be done later. We don't get to stand around.
Yeah, the nurse's station really isn't the hub of social life like some of the TV shows make it. Yeah.
Not sitting around watching Desperate Housewives on the computer all the time. Yeah.
No, not a lot of chatting and hanging out.
Okay. So, with all of that's going on, I mean, could you describe kind of what some of the examples of what you're doing? Maybe the meds and moving patients, or what? Give me some actual examples of what it is you're
I think
doing.
Shannon's probably like the boots on the ground right now. She's at the bedside providing the care.
Sure.
And that's the great thing about nursing. You can be hands-on in the patient care, and I've kind of transitioned more to the business side of things and the management side of things. But that's one of the great things about our field. It's just so diverse in what you can do, and whatever interests you may have, somehow nursing could fit into it. I just think it's wide open. But fortunately, I still can have that patient one-to-one contact. And you walk into our office in the morning, and it's just crazy. Everybody's getting their assignments for the day, getting a report from last night. The phone's ringing, patients are calling, doctors are calling, other nurses are calling, and people are just getting set for the day. And we have one plan, and probably by the end of the day, we've shifted gears about 50 times and have a whole new approach to the rest of the days. So
do you think that is it necessary to be that way, or is it just that the system has evolved that way, where you say your plans are changing all the time? Is that just the way that you have to do it?
It's the way you have to do it. It's a dynamic field. It doesn't stay the same for even an hour, and prioritizing is probably the number one thing they want to get across to you in nursing school. You have to be flexible and willing to change and go with the flow.
So how different is every patient? Is it pretty much the same routine for every patient, or?
I'll let you answer that.
I would say not.
Okay.
There's different mental diseases. We have patients with dementia. Yeah, we don't have anybody that's the same. And a lot of people may categorize like, it's the nursing home. It should be all the same. And it's really not like how the nursing homes are on TV either, where they just pass a pill and that's it. You might go to a room, somebody might have a fall, they might need something. So it's constantly, they might ask you if they just want to drink of water. But we're the nurse, we do that. We help them with whatever they want. Some might have a hard day, and you sit there and you talk to them so they don't cry. And so nobody's the same at all. So it adds to the joy of nursing, I think. If everybody was the same, it'd be very boring.
Yeah.
But you have to meet their needs. Whatever they need at the time, you want to help them and see what you can do for them. So it isn't just giving them a pill and taking their blood pressure. It's seeing how they are doing, see if they are getting better. We have a lot of rehab in our area, too, that a lot of people come through the nursing home to get rehab, and we have a really good rehab center there. So we just want to constantly see if those people are improving, to see if they are able to walk what they're supposed to be doing. And so everybody's different.
So the individualized care is a huge focus. Standardizing care and making sure that you're using evidence-based practice, that what you're doing is based on research is important, but at the same time, keeping it unique to each patient.
How easy is it to do that, to try and base things on research? Because the research tends to come from all sides of the world, and you'll have oftentimes conflicting research. And do you have to wait for someone in particular to endorse it before you use it in a practice, or how do you manage that?
We have a very standardized approach to that. Unfortunately, we're in the Mayo Health system with access to some of the best research there is out there that's all been vetted and gone through by experts. And so by the time it gets to where we'll be operationalizing it, it's been through the process, and we know it's something we can depend on. So
great. So as part of that, in the research and how the field has been evolving, so we've got one aspect is technology, and that's been definitely moving. Some of the other aspects, though, is that we have what has been becoming a continuously aging nursing staff, where we're all aging, but our average age for nurses has been growing and growing and growing over the last 10 years. Do you think that is that a good thing? Is there something that needs to be fixed there? Now, Shannon's very new to the field, so this is probably a different issue for you, but do you see this being something that needs to be combated right now? Or?
As far as addressing, I'm a huge supporter of making the workplace friendly to all generation levels that we have, because everybody contributes so much. I'm sure Shannon would agree that there's nothing better than knowing that there's a seasoned nurse on your shift that you can ask questions to, that will just come walk in. They've been through everything and are always a great resource. And at the same time, the nurses that are a little more seasoned love seeing the younger nurses come in, and I won't say that it's always like perfect, because there is debate, and nurses are known for having strong personalities, but it's good. You know, it's all, we need every age and every outlook on how we do our work.
Great.
Yeah, the experience is huge. You know, as you know, like with us, there are some newer things that we graduated with that they might say, oh, well, you know, this is new to them too, or something. So it, just working together, you know, kind of talking things, it does help. And I know for us, younger nurses, it is nice to go up and talk to somebody, because they're like, well, we did see this, and, you know, if there's a certain condition, and this does work, you know, so it is good to have that experience, you know, experienced nurse to talk to.
So Shannon, being that you've only been in the field a year, what brought you to the field? What made you say, I want to be a nurse?
Well, I've had diabetes for over 20 years.
Okay.
So I've always kind of been into the health field. I've actually worked at Mayo almost 10 years. Before this, I've always worked in the health field. I've always kind of had that mothering ability or whatever, nurturing. And so it was just me, I guess. So I finally went for it. And I do actually, I am going to pursue to get my BSN and possibly master's down the line. And I really want to get into more the education part.
Sure.
So I think it's just, I finally did it. But it's always kind of been there.
So being new into the field, what has surprised you? What is something that just kind of came out of left field and said, wow, I didn't expect that we'd be doing that? Anything?
I really can't see anything right now. It's being, you know, working in the health field. I used to draw blood too at the hospital, so I kind of knew what I was getting into. And I knew they weren't sitting around, and I like that. I like being busy. I like helping people. I don't think anything really threw me at this point. Maybe I haven't been a nurse long enough.
Well, and then now, Tammy, your role has changed. You've gone from being a floor nurse to being now a nurse manager. How has your skill set had to change over time? Because nursing and business degrees don't necessarily ever come hand in hand, really. What have you had to do to change your personal skill set to become a nurse manager?
That's such a good question. And, you know, I always say life is backwards. If I'd have known today what, you know, all these things that I'm learning when I started this job, I would have gotten the business degree. And the biggest advice I could give to a new nurse is be diverse in what you learn. You know, get a bachelor's and take a lot of different classes, focus on business and communication, because nursing is different than, you know, 40 years ago. Now we are very concerned about cost containment. And so my focus has been to learn about the budget, learn about management, what works and what doesn't, and that's kind of the school of hard knocks too. Fortunately, I have staff that's patient with me, but you know, it's just putting all those pieces together and then still maintaining the ability to be a nurse and assess and do the patient care types of things that are required.
So another part of the skill set is that as your nurses are certainly a very significant portion of clinical care, but you're not the only portion. You've got the physicians, you've got laboratories, you've got pharmacies, you've got other medical centers, and in the case of, say, a nursing home, where you're definitely going to have all these partner facilities. What guidance do you get interacting with these other people, and how well does that work? Do you have to get a translator to talk to somebody in lab, for instance, or how does that work out for you guys?
Well, for me personally, working at the nursing home, we have a pharmacy in Adams. They're only open, you know, Monday through Friday, 8 to 5. So we do have additional meds, you know, like an emergency kit if we do need something in an emergency situation or something over the weekend where we can't get to a pharmacy. We also, like I had said before, we contact Awesome Medical Center, you know, talk to the on-call doctor, the PAN nurse, you know, for any different situations that arise, you know, that we can't do ourselves. We also have like an on-call nurse. So if there is something that we would need medication for something that came up or whatever, we do have people that we can talk to about it too. As far as labs, we do work with Adams Clinic, and they will draw, they do our INRs. We draw our own labs in our facility. It's just, a big thing is communication.
Yeah, good communication.
Talk to whoever you need whenever. You have to, prioritize your time to make sure you get to the pharmacist on time, different things like that. If you need something, you have to make sure you look ahead so we have that supply on hand.
Do you get specific communication training?
You don't, and I think that is probably, it needs to be a focus and a priority in our field. That we're always working on communication and studying other fields that are really, that excel in communication, like the airline industry, and using a format of how you're going to consistently explain a situation and what your recommendations are, and to get the point across without a lot of extra information that, say, a doctor doesn't need who's in a hurry. So that nurses do communicate differently than doctors, and so sometimes that can cause a little friction, but it's something that we're aware of now, I think, in our industry, and definitely working to improve.
We currently use the SBAR. So it's situation, background, assessment, and then recommendation. So when we do call into the doctor, we can give them what the situation is and a little more about it and what we can do. So we use a lot of critical thinking. So we can kind of help out and say, this is what I think we should do. And a lot of times the doctors will approve it or come up with something different. So we try to help out, that part as much as we can too.
Okay. So communication with nurses and doctors definitely different. You've also got communication between females and males also being very different. Now, nursing has been very dominated by women for years, and that's starting to change now, where it is starting to even out a little more. Certainly not by any means even male and female, but more and more males are getting in the field. Why do you think that women have always dominated this field? And two, do you think is it beneficial getting more and more men, or is this going to create more communication problems, or how is that going to work in the future, do you think?
I think it's an asset. I think we need representation from men and women in all different cultures. We need to reflect what our population is. So we need everybody to help us be good at what we do. Obviously, there are always challenges when anybody sees things differently, but in working in a large hospital setting with probably an equal number of males and females, I enjoyed it. I thought it was an asset and not a detriment.
We had quite a few male nursing students too, so and they were great. And I think it is good for the residents, patients, whoever, to have the female or the male. Some may feel more comfortable with the female or the male, but then they have an option too at that point.
So as you talk about diversity, not only do we have more, we have a larger diversity of LPNs and RNs and those type of categories of individuals, but we also have this large diversity, male and female, and also with nurses versus lab versus pharmacies. And now, in the last few years, we've added that the cultural diversity has just exploded in the United States. Do you see that our nurses having to take on additional training there, or what are you doing to help engage that cultural change?
At Austin Medical Center, we have the opportunity to take Spanish classes because that is a growing demographic in our area. That is definitely something that is a great thing for a nurse to come to her profession with, or his profession, I should say. We have to focus on that more. We have to broaden our horizons. Mayo is a very diverse patient population, and we have access to all different types of interpreters, and focus on making sure we're providing exactly what the patient needs to understand the information we're giving them. Yeah.
Okay. So as both of you have very different experience levels right now, what would you recommend for people who are thinking about nursing, what's your kind of your one thought to throw at them who are
Go
people
for it.
who are
Get as much education as you can,
okay.
and do it all at the same time, because once you get in, you kind of get stuck, and you might not want to go back. But I've talked to, we have a lot of nurses' aides that are thinking about nursing, and so I tell them totally go for it and keep going. You know, they have, you know, set your goals high. If you want to be a nurse anesthetist, go for it. Just keep getting education, because we can never know everything.
That's right. I just think, you know, with the aging large population, we're going to have a lot of people to take care of.
Large as in numerous, not large as in installation,
well, all
right?
of the above. I mean, and that's the other thing, all the preventative health care and the exciting things that we can be part of in our field. One of my favorite parts of my job is to work with my employees that are currently in nursing school, and to see them get to that point where they're almost finished and have their nursing job all set up. So that's very rewarding, and anytime anybody expresses an interest in anything about nursing, I just encourage them to look into it and stick with it, because it isn't easy, but it's so rewarding. Sometimes you almost feel guilty because you get more from the patients than you feel like you're able to provide for them.
And the other thing with nursing, it's you can be anywhere. If you don't like being a floor nurse, you could be, you know, anything else. There's so many different areas.
In
for
a
nursing.
helicopter, on a cruise ship.
Yeah.
Well, you know, I think that's actually a beautiful way to close as we're running out of time here. But I think that's an amazing thing to hear, that there is so much work going on in nursing fields, and on a day-to-day basis you have so much that you have to get done, and yet you can walk away saying that absolutely people should get into this field. And I think that's an amazing thing to be able to hear that. So that's just a wonderful tribute to the field of nursing, of how much that can really contribute to patient care, and how absolute critical and core it is to patient care. And at the same time, you can walk away and say, hey, I feel good about what we're doing. So
Yeah, we're lucky.
so okay. Well, I'd like to thank you both for coming on the show today. It's been a pleasure having you here. So, and again, this has been Sean Riley with Health Connections. Thank you very much.